Everyone, I'm on my lunch break at work, and I do core a couple times a week, especially after having two babies. So I am still recovering from having my youngest is 1, so I'm still working on that core. Definitely feeling a lot stronger. I'm having less back pain with my job. With really the hardest part is carrying that car seat, carrying the little ones is where I would get a lot of my mid back pain. And once I started strengthening my core again, that helped with a lot of things. So this exercise is something that is foundational, and we do it a lot in physical therapy, especially for people that have back pain, because generally the core is weak. It's not something that we think about or that we engage throughout the day. So this exercise is often called the transverse abdominis, like an isometric, or a pelvic tilt. Most people would know it as a pelvic tilt. You're not really going to see a lot of motion with this exercise, but I'm going to talk you through it, kind of how I show my patients how to do it. So you lay on the floor. If you can't get on the floor, lay on a bed. And the muscle that we're targeting is your transverse abdominis. It's your deepest stomach muscle. So, your first layer are those abs that you see, transverse abdominis, and then after that, you've got your your diagonal muscles. I'm losing the word right now, but you've got a couple ab muscles going diagonally, and then underneath all of that is the transverse abdominis, and it runs like a corset. It runs transversely across your stomach. It's attached to your hip bones. It's attached to your low back. It comes around here and is attached back here to your lumbar spine. So when you strengthen that just kind of helps pull everything in and tightens everything. It just helps with your alignment, helps that low back. So the way that I cue people is I will put my hand under their low back, and I'll tell them to pull the belly button in. Try not to move anything else except you can tilt your hips back. You're gonna tilt your hips back. So I'll actually have them exaggerate it and like arch your back up. You can't see, but I'm arch your back up off of the floor and then press it down into the floor. So you shouldn't be pushing through your feet. You're tilting your hips down and then coming back in. So, and then holding that for 10 seconds at a time. If that's difficult for you to do, start with 5 seconds. But holding it isometrically, holding it for a length of time is so important. And also, I will tell you not to hold your breath here, because it is a difficult exercise to kind of get if you haven't engaged this muscle in a while. So usually I'll do about like 10 sets of these, 10 sets, 10 seconds. So what should be happening is my low back, I shouldn't be able to put my hand through underneath my back here. So imagine there's like a P under your low back, and you're just trying to smash that P. So you're not pressing as hard as you can, but you're giving it like 50 to 75%, and you're holding it. And I can talk while I'm doing this. I'm not holding my breath. And you should feel it really low in the abdomen. You should feel it down here, not up here so much. You can feel it anywhere, but you should really feel it low across the abdomen. So once you have mastered this laying down, you can add marches, you can add other things, but what I like to encourage people to do is, okay, now you know how this feels while you're laying down. I want you to try to do it while you're sitting up, pulling that belly button in and holding, around 10 seconds. And then, okay, now you can do it sitting up. Can you do that while you're standing? Maybe while you're, see how long you can hold that, while you're doing dishes, or while you're walking. Okay, I'm walking down this hallway, and while I walk down this hallway, I'm gonna pull in that belly button and just engage that lower abdomen, that transverse abdominis. So even for myself, when my low back starts hurting, I just start doing those pelvic tilts, and it'll just kind of relieve that pain, and it just engages that core again and allows my back muscles to chill out, because this part of my body is doing what it needs to do. So that's it for this exercise that I do. It is definitely a foundational exercise for all core exercises, and it's just a good way for your brain to connect and know how to engage that core. So hopefully this helps.